Hey guys, it's your girl Antonia, and I'm here at the Atlanta Ghost Plastic Surgery with the lovely Keisha Green. And today we're going to get her started with her first injection for our Mediflex weight loss program.
So I'm super excited. Today I came into Goals to start the Mediflex weight loss program. I'm excited. I have a wedding waist that will be loading, and I know this is going to work for me.
And this is Dr. V from Ghost Plastic Surgery, and we're doing semaglutide injections today for our beautiful patient Keisha Green, and we're going to demonstrate how to do it and how to do it yourself. And I'm going to start with actual box that you as a patient will receive at home. It comes with ice, it's perishable. So once you open the box, you will find there all the ingredients needed to inject yourself. So you unpack it, you will find the syringes. You just need to take one of those. So you would need one syringe, and we're going to go over the steps of the process. And you would need an alcohol swab. I'm going to move that away. Okay, and actually you will see the ice packs will be there, and you will find the medication right here. So we're opening the medication and putting it next to each other, just to preparing for an injection. You will see a vial in a second. So here's a vial with the medication. It's called semaglutide, as you can see. So now we kind of prepared to do the injection itself. If I'm injecting to the patient, of course I'm going to wear the gloves. What you should do before you inject, you just have to make sure that your hands are clean. So you basically use Purell, okay, the hand sanitizer before you do it. Then you take a syringe, you open it up, you can see there is a plunger inside and a barrel here. So you kind of prime it before, just make sure it's moving smoothly. You put it aside, you opening very easy, you just open the vial and you can see the rubber piece in the center. You always need to prime it with an alcohol before you inject to reduce the bacteria on the surface. Then you take a syringe, and if it says to inject with your dose 10 units, you push it to 10. If you need it at 20, it's according to your prescription, you just follow the instruction for the dosage. Be very careful to read the instruction, it's very simple. Usually we start with 10 in this case, and I just put 10 units of air into the syringe. I'm going to open the syringe. I'm going to put the syringe right in the center, as you can see, and I push the air in. Now we're going to turn it vertically, and you're going to see, because it's actually colored liquid, that you're going to pull 10 units inside the syringe. Okay? Once you put 10 units inside the syringe, you have to make sure the gas bubble is gone. So you take it out. Okay? And we're going to give it to Keisha. She's going to inject herself. That's why I'm not wearing the gloves. Okay, and I'm going to instruct how to inject. So you want to push the remaining air. Now this is ready for injection. Now I would need Keisha's, the belly, would be the belly. Yeah, I can give you a Purell. But right now you kind of don't need it because, anyway. And you can go either, if you have plenty of fat tissue, okay, underneath, and this distance is very short, you just can go 90 degrees in. If you don't have much, and this is the easiest place to inject because you don't have to sink, it's subcutaneous injection, meaning you just have to deliver this medication under the skin. You don't need further, you don't need muscles, you don't need to do intramuscular, it's just very easy injection. Or you can go 45 degrees to the skin or 90 degrees to the skin. It just depends how much fat you have underneath. If it's very thin skin, you should probably go 45 degrees. So I'm going to give it to Keisha. We just gonna go ahead, clean the part of the area. Yeah, where you're going to inject. All right, I'm going to pass you a syringe. All right. And you just inject in the same spot. Just put the needle first. Put the needle first. You inject the needle. You don't feel it, right?
No.
Push the whole medication. Hold for a second. After that, make sure there is no substances coming in. You don't have to really push inside because the needle just needed to go under the skin. You remove it. And then all you have to do is to dispose that needle in a plastic sealed container. You better actually purchase yourself in any pharmacy sharps container and to dispose it there. Or you can take a bottle, that puncture proof bottle, and you can dispose syringe in there and you can close the lid. Okay? This injection is done. The medication was delivered. There is no pain. And once you finish, you have to make sure that you put medication back in a fridge because it was delivered on ice, but that simply means you have to be putting it back in a package, and you're going to put it in a safe place in a fridge, in a regular refrigerator. You don't need to freeze it. So we're putting it all back since we have ice packs here. Okay. So I'm putting the medication back in, and whatever the patient received at home, I'm returning it all back, the alcohol swabs and the syringes. We're going to pull the lid back in this case, but you just simply have to put all this in the fridge. That's all. This is mission accomplished. Of already being on the market different medications. It's semaglutide is a generic name for Ozempic or Wegovy. This medication, the beauty of this medication, it stabilizes your blood sugar levels. It actually helps insulin in action, but at the same time it creates a sense of fullness, so you do not really overeat. It kind of stops you there. So even if you have a party or you're a binge eater, you will find yourself like you kind of stopped somewhere and you don't want to continue eating. So it will tell you enough is enough. That's basically what it is. From those two perspectives, it's actually good for stabilizing blood sugar levels. It's actually cardiac protective in that respect. And from weight loss, the marvel is that lowers the sugar, controls the insulin, and control your, not really even appetite, it's mostly control your fullness and not letting you, just send you the signals that you have to stop eating.
Okay, do you recommend this before FlexScope or after getting FlexScope?
It doesn't really matter. You can do it before FlexScope, especially people with a higher BMI. We do advise to lose some weight, and it's advisable probably by any clinic. And for just the general population, it doesn't really matter. You do it before or after, as long as you have a desire to lose weight, you want to stay on the diet, the medication will help you to be attached to it.
And honestly, if you've had work done and you've begin to gain weight, is also a way to bring your weight back down and not go and have to have the surgery again. Because honestly, I have FlexScope 2 years ago.
Yeah.
Here, and now
fun.
I'm doing this. So yeah, I think it's either way. I think it's good to not, go have the surgery again if you've already had it, just to be able to get.
I mean, you have to understand your perspective. The people who wants to lose weight, and that's their goal for many reasons, for health reasons, for obviously self-appearance reasons, which is the most common cause. People just want to lose weight, and that's one of the breakthrough medications that we have today on the market. And I think it's pretty genius medication. I think it's going to get continuous and improved, and I think from that family of medication, we're going to have even more, maybe even next year. Okay, but again, the medication is pretty good. It has a very good response for all across the board, not just from our patients, but even from Hollywood people.
Mm-hmm.
It's pretty common right nowadays used for weight loss. And it's not a controlled substance. It has nothing to do with your heart or with your brain. It's not a stimulant of central nervous system like Adipex or phentermine. This is completely different medication to be used.
Somebody has a question. They said, what if you already use Ozempic for diabetes?
Okay, if you're already diabetic, and we've been telling that before, and we're not accepting those type of patients because you're already on Ozempic, that means you're already on the semaglutide. However, even those people who are not on Ozempic but taking diabetes medication, you have to consult with your doctor before you can administer any additional sugar lowering medication. So if you already have a diabetes and you already have a doctor, your doctor or endocrinologist following you up with certain medication, you certainly cannot just go to any diet program and do that medication, because it might result in a hypoglycemia, lower sugar. It might interfere with your current diabetic medication. So we urge you, before you do this, you have to consult with the endocrinologist doctor who's taking care, and we certainly don't want to be a part or mess up with that program. So you have to go back to your doctor treating diabetes and see if he wants to add it or his decision is not. It's really a consultation with your physician.
Okay, so we have some questions for Antonia. Antonia, can you just describe and let them know prices and how it pretty much works as far as different payment options, how we can pay, like what they can do?
So if you do want to begin our MediFlex program, we can actually get you started for a 30-day plan for $475. If you want to go on ahead and start with a 90-day plan, we can do that for $1,300. We also will send you to get your blood work just to verify that you do not have any pre-existing conditions that will prevent it. And that price is also included for your labs.
So what if they're not in this state next to our goals location? How can we get them to get their labs, to get the whole medication, get everything started up?
We recommend going to Quest. We'll actually get you a requisition to go out to any Quest near you, and the medication will actually be shipped to you in the mail.
Yeah, it's actually very simple. We just send you a requisition already pre-printed with our information. You can just schedule an appointment within 1 or 2 days with any Quest blood drawing center. You just bring them that requisition, they're going to draw your blood. This is it. We're going to get directly result sent back to us. We're going to schedule an appointment with a provider who's going to further talk to you about the medication, about your plans, about the diet, and we send the medication to the pharmacy and it will be delivered to your door. This is as simple as that.
Okay, no problem. All right, ready. See you guys later.
Alligator.
All right, so I've had my MediFlex today. I came into Goals to have that done. And I just want to tell you guys that literally I didn't even feel the needle. I did it myself. And not only that, I feel absolutely normal. Like when I came in, I don't feel any weirdness or anything like that in my body. So I'm just excited about the weight that I'm getting ready to lose.